Hello, this is Dr. Miles Weinberger, and I'm going to talk to you about the problem of habit cough that bothers a fair number of people and can ruin their lives. And I'm calling it an update because there really is a need to look at some new information that provides a different concept of this problem and how to treat it. Now, traditional causes attributed to chronic cough have been, first of all, what are called ACE inhibitors, which is a type of medication used for hypertension. And it's easy to deal with that because there are substitutes that can do the same thing that do not cause the problem with chronic cough. Asthma can cause chronic cough, but a short course of prednisone, if it's asthma, will stop the cough. And eosinophilic bronchitis is something like asthma, and also it responds to prednisone. So if it doesn't respond to prednisone, asthma or eosinophilic bronchitis, then you know that that's not the diagnosis. There are traditional but very controversial diagnoses. And gastroesophageal reflux, also known as GERD, and upper airway cough syndrome, which used to be called the postnasal drip. Those are real things, but they happen in a lot of people who don't cough. There's no evidence that it causes cough. It can be an aggravating factor. There are other things, occasional causes of cough. Many others causes, such as foreign body aspiration problem, particularly in kids, young kids, but can happen on anyone. The tonsils and the uvula, which is that thing that hangs down in your throat, sometimes are abnormally large, and they can compress an area called the epiglottis, which is very sensitive and can cause coughing. Lung cancer, if it's in the airway, can certainly cause coughing, and all sorts of respiratory tract infections, and I'm not listing them all, but a common one is whooping cough, known as pertussis. Protracted bacterial bronchitis is a problem in predominantly infants and toddlers, but occasionally can occur in older kids. And bronchiectasis is a damaged airway that can also cause chronic cough. And then there is this problem in this 10-year-old boy. They've been doing this for a month. The cough persists daily during most waking hours. He obviously can't attend school with that. He gets a lot of anxiety and stress because of falling behind in his schoolwork. This doesn't stop until he's sleeping. When he's sleeping, he doesn't cough. And here's another one. An 11-year-old boy from Mumbai, India. He had an episode like this a year ago. Went away in a few months. It's the second episode. It's been going on for 3 months. He's been doing like you see there. His father estimated that it's more than 800 coughs per day. And again, when he's sleeping, the cough stops, no matter how bad it was during the day. And this one we don't have a video of. The 36-year-old male with a chronic cough. This is what he sounds like. Somewhat similar to the two boys. Father, a physician, emailed me this from him in Germany. His 36-year-old son had been coughing like that for 6 years. Not always that severe, but it's going on all day, about 7 coughs per minute, worse in the evening, considerable social consequences, obviously, from it. And again, once he was sleeping, it wasn't there. That was the only time he wasn't there. Now, this has been known for a long time. This goes back a couple thousand years. In a translation of it, which is chapter 23 there of a biography of 12 successive Roman rulers. So Tiberius Julius Caesar Augustus was told, was said that he had merely taken a medicine for a habitual cough, which was growing worse. And here's another one from the 17th century in a medical book. And a patient who had, they called it convulsions, but it was actually cough. And it had begun periodical and habitual, they called it. And the only time she didn't have it was when she was falling asleep. And there's this one also from the 17th century, referred to, again, the habitual cough that started with a cold and then persisted even though the cold was gone. And then there's this 19th century medical book written by Charles Creighton, a British physician, and he described, that is, a habit cough, a reflex effect persisting after the cause is gone. And he called it an acquired habit. He went on to state, which was an amazing foresight, as you'll see when I talk about treating this, he said the treatment of it is to break the habit. Now that I was, however, this habit cough, recognized repeatedly in the medical texts, today is seen to fit into a classification known as habit disorders. This classification describes disorders that are involuntary, repetitive behaviors that are distressful, that interfere with normal activity, and consequently has quite undesirable consequences. This is a list of other habit disorders. And again, they're all voluntary, repeated unwanted behavior that cause distress. They're what we call functional, meaning they have no organic basis. and they cause disorder. And the repetitive behaviors, to name some of them, that become disruptive and cause distress include tics, which are involuntary sudden movements of sounds, picking, nose picking, that's the rhinotilexomania is a fancy name for picking their nose. The next one there, onchophagia, is a fancy term for nail biting. Trichotillomania is one of the very common habit disorders, and that's someone who, girls who tend to pull their hair out. And dermatillomania are people who have chronic skin picking. They keep picking at things and cause a type of dermatitis from picking the skin. So then there is habit cough, which fits into those categories. This is a daily, repetitive, non-productive cough, absent during sleep. It's involuntary, it's repetitive, it's non-productive, and it falls into that category of a habit disorder. It's important to be able to categorize this because it gives some clues as to how to treat it. I'd like to now give you some information about the epidemiology of habit cough. And also a little bit about how it starts. From studies that were published from the University of Iowa when I was there, and later from the Brompton Hospital in London, about 9 per year were seen at these pediatric referral centers. That's of children. So we have an idea of that for children, this is not a real common problem, but it's also not terribly rare. We think that major referral centers, other than the 2 I mentioned, are probably going to see about the same number. For adults, we know less about the epidemiology, but what we do know is that of adults seen at major referral cough centers, over 40% are undiagnosed refractory. It was first described by Hock in 2005, and this has been repeated in subsequent review articles in the New England Journal of Medicine and the Journal of Allergy and Clinical Immunology. So let me again reiterate the diagnosis of habit cough. It's a daily, repetitive, non-productive cough that is absent during sleep. And that absence during sleep, despite coughing multiple times, sometimes per minute, sometimes per hour, but on daily, it's repetitive, it's non-productive, and it does stop when they're sleeping, and probably the only time that it really stops. It's what we call a functional cough, meaning there's no physical reason for it. A honking or barking sound is common, but the sounds vary with the patient, and sometimes they are a much softer cough, more of a throat clearing. The initial cause of a habit cough is usually a cold. Exposure to an irritant is occasional cause, of that national trigger for the initial episode of cough, but the vast majority are just an ordinary viral respiratory infection. We don't know why this occasional person will go on and get habit cough from something that everyone gets, common cold. But we do know something about what keeps it going, what keeps it coughing. And that's important because it relates to how we treat it. Cough causes inflammation felt as a tickle or irritant in the throat, or sometimes the feeling is a little lower. And it's that tickle or irritant that the patient feels that's been caused by coughing that causes cough. So you have a vicious cycle where coughing causes the very cause of what keeps the cough going. And this is just some of the support for that explanation. There was a study by Richard Irwin in 2006, published where he bronchoscopically, by use of a bronchoscope, obtained respiratory mucosa, respiratory mucosa, and looked at it under a microscope with special stains. And he concluded, since this was also sane in people who had a real cause for cough, such as asthma or COPD, so they're causing for a real cause. So these people who were perfectly otherwise healthy had the same inflammation as the people who had a cause for cough. So why is that there? And he concluded, and I quote him, "Our findings suggest that airway inflammation associated with chronic cough may be due to the trauma of coughing itself," just as I explained. And then another support for that is a study published in 2021, Dr. Shapiro and a bunch of colleagues. They also examined mucosa bronchoscopically, getting a sample of respiratory mucosa. But instead of just a usual stain to look at it under the microscope, they did a special stain for nerve endings. And they stated that although increased nerve density may promote development of chronic cough, it is equally possible that nerve growth is a consequence of chronic coughing that contributes to its persistence. So, ergo, neuropathic inflammation, both ordinary inflammation demonstrated by Richard Irwin and increased nerve endings and the airway, is the very sensation that patients call a tickle that makes them cough. Patients feel that as a stimulus for coughing, that feeling they have, that sometimes they call it a tickle, sometimes they just call it an irritation, and it's the stimulus for the recurrent coughing. It's not the start. The start, as I said, usually starts with a cold, and sometimes people actually say, first there was an ordinary cough that they get with every cold. And then after a week or so, it changes. It changes into this habit cough. The cure of the habit cough is a process called suggestion therapy. And it's a simple behavioral technique. I'm going to talk about who started that. Bernard Berman in 1966, published a study of 6 children that he saw in his practice over 5 years that had the same symptoms: frequent, non-productive, daily barking cough that was absent once asleep, despite the fact they were barking all day, just like the first boy and the Indian child. Ages were 9 to 13 years, equal number of boys and girls, and he stopped the coughing in all of them by what he called the art of suggestion. He considered the nomenclature for what to call this chronic cough, because there had been case reports of this earlier that had called them psychogenic or tic. But he said it's not psychogenic because they were perfectly normal psychologically, and it certainly wasn't a tic. There's a difference between a tic and even a verbal tic, which makes a sound, and a cough. A cough involves deep breath in, closing the glottis to create compression as they push against the closed glottis, and then sudden release of air that is compressed in the chest that makes the sound of a cough. Tics are very different. They are also habit disorders, but they're not coughs. And so he decided that based on the fact that there was nothing else wrong with these kids, and clearly they were coughing, and they responded to a simple behavioral technique, he decided that habit cough was most appropriate. Now, my first publication on this was in 1991. And this involved habit cough in children that were seen in our clinic at the University of Iowa. We described that treating them with a brief session of suggestion therapy was effective. The index case that initiated the desire to report a bunch of these was a 15-year-old girl. She had months of intractable cough, and the cough stopped within 15 minutes of suggestion therapy. Dr. Bakshin, who was my fellow at the time, asked the question, is this quick fix permanent? And so he looked at 9 clinic charts from the recent past before 1991. And they range from 6 to 17 years of age. Median was 11. And 1 week later, 1 had no symptoms, 8 had minor self-control symptoms. That is, the cough did not persist continuously. The patient was able to stop them on their own. And then he followed up an average of 2.2 years later in 7 of them that he was able to contact, and 6 had no symptoms. 1 had very minor self-control symptoms. And then the second author here, Dr. Lindgren, was a pediatric psychologist who gave them a test called the CL90R that showed that they had no other psychological causes. They had no other psychosomatic type causes. They were perfectly normal kids. In 2016, we looked at the long-term outcome of the treatment of habit cough at the University of Iowa in the clinic. And we had this publication entitled "Cough Without a Cause, the Habit Cough Syndrome." And coughing was observed in 85 during the clinic visit itself. 81 of the 85, 95% of them, cough stopped within 15 to 30 minutes using suggestion therapy, not just by me, but by whichever clinic physician was scheduled to see them. We taught all of the patients, including those who weren't coughing at the time when we were in the clinic, but had a convincing history of habit cough previously. We taught them all autosuggestion, and that is, we taught them that what we did in the clinic, they could do it all themselves on their own. And then in 2019, I had the first time we had suggestion therapy for someone who had been coughing for 3 months. And we did this remotely because the patient was almost 3,000 miles away from us. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Mm-hmm. Still hard though, huh? Okay, we're gonna go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. Mm-hmm. So I'll bet you can do 4 minutes too. Because so this is a demonstration. Control. You're not letting me control you. You can see the whole thing at this link here. So this is what you have to be doing. I'm not going to show it now because of time limitations. What was important about this, not only did we stop the coughing in this girl who had been coughing for 3 months before, but her father placed the video that he was making on YouTube and on his website that he created, a website called habitcough.com. And we ended up something that was, as I said in this article, unexpected and unintended. And that is, we started hearing from both parents of other children who were coughing and from parents, and then also from adults. And this is an excerpt from an email that one of the patients sent us. And essentially, this is a 7-year-old girl who had been coughing for months, started with a cold, as the mother said. And after a few weeks, the cold symptoms went away, but the cough persisted, just like described in the past. And since it didn't help, they pulled the video up on YouTube, and the girl named Riley, in tears, said, "I can hold the cough back like Bethany." And then the coughing stopped. The mother said, "Like turning off a switch." She was writing this 4 days later and said there had been no cough since then from watching the video. And this is the same sort of response from a 30-year-old male. Suffered a chronic cough for almost 2 years. In that time, he said he saw many doctors, took many medications, had medical procedures, in an attempt to end the cough. Nothing worked. And then he found the website that Bethany's father had created, and he watched Bethany with me and followed the same procedure and saw the effects almost immediately. He stated, "I'm truly amazed that such a simple procedure at no cost, with no medication, can be so effective." And this gives you a feeling of how many we've seen. This is created about a year ago, so the numbers would be even larger today. The red dots are children who had been influenced positively by watching the video. We call that suggestion by proxy. The blue dots are adults who indicated by email that they also had been positively influenced and able to stop coughing from watching the video. And we've now arranged voice overlays in multiple languages so that non-English speaking people can benefit from watching the same video. And we've had feedback, at least from German, that a child watched a non-English speaking child in Germany watch the video and stop coughing. Now, this is something for the physicians who may want to provide suggestion therapy for a chronic cough that they're encountering. And it involves establishing rapport with the patient. That's very important. You have to have confidence in success. That is, you don't approach this as a maybe this will work. You approach it from the point of view of that you're going to be confident. The patient's focus is on attention on suppressing the cough, as you saw me doing with Bethany. Now, they're not just suppressing the cough completely, but we're explaining age appropriately so that they understand what's happening about this vicious cycle. The coughing itself is causing the damage to the airway, this inflammation, that what they feel is making them cough. It's important to reinforce brief successes, as you saw me doing with Bethany. And I emphasize that it's not me, it's not the physician, and not the parent that's going to control the cough. We're showing the patient how they can control the cough. And the success, as usual, initially in about 15 minutes, but most of them have to reinforce that through auto-suggestion techniques that we've taught them. And the auto-suggestion that we recommend, and this is recommended for both children and adults, is 15-minute practice periods as often as needed. We had one boy, adolescent, who felt he had to practice every minute. Others are more realistic. It's important that this be done in a quiet location with no distractions, because they have to focus on the feeling that makes them cough so that they can take sips of water before they cough. The sips of room temperature water for the urge to cough are an alternative behavior that is done when they feel the urge to cough and before they cough. They are instructed to concentrate on not responding to that urge, to being aware of the urge. At first, you do it briefly. If they're coughing several times a minute, get them to hold the cough for maybe half a minute. And once they do that, tell them how fantastic that is, and they go for a whole minute. And they go for 2 minutes and 3 minutes. And if they go 5 minutes, they know how to do it. And the person performing this with a child or with an adult has to express confidence that the session is actually going to eliminate the cough. It's important to consider that the urge to cough may persist. But once they get started and learn how to resist the urge of cough, they can, with additional practice, continue it forever. And we advise them, and many of the patients have done this, carry water with them so long as the urge to persist until the feeling goes away. The feeling, how long does it go away? Probably 3 to 4 weeks before the feeling is totally gone, but it gradually gets lessened over that period of time. And so what's important here is, remember the words of the great Yoda, this isn't something you try. This is something you do. And there is no try. It has to be approached from the point of view that you can do it, and that confidence is then transmitted to the patient. So the take-home message, daily repetitive dry cough absent during sleep, is a habit disorder known as the habit cough syndrome. It's a daily troublesome cough that occurs in both children and adults. And habit cough may last for months and years, or in some, it may stop and return in some the next time they get a cold. So there are various patterns here. And the important thing is it responds to absolutely no medication. Medication is a waste of time once habit cough is diagnosed. So, but habit cough does respond to suggestion therapy by direct contact, as we did in the clinic, by teleconference, as I showed you that demonstration exhibit, and by proxy. By proxy, we mean children or adults watching that video are influenced to themselves learn not to have that coughing. And so that's all for today. Any questions?
Dr. Weinberger states that even though this is a video of a young child being cured, adults will want to mimic her and follow her lead. Dr. Weinberger's banter is purposeful to the suggestion therapy. He wants the patient to have at least 2 large vessels of body temperature water, not cold or ice water, at the ready, and to sip the water on the pre-cough tickle. Do not gulp the water or sip the water atop the cough. He wants the patient to be in a quiet area with no distraction. He wants the patient to watch this video once per day for the following 3 to 4 days or more to perfect the recovery technique. He wants the patient to keep an opened bottle of water with them at all times, cap off, and to sip atop the tickle, not atop the dry cough. When you have 2 vessels of body temperature water ready and are in a quiet area ready to concentrate, please begin watching. Report any successes, questions, or comments on habitcough.com.
Great girl. You've done it. Over 3 minutes. Hey. once you cough once, try not to let it happen again. Try and hold it back, because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Still hard though, huh? Okay, we're gonna go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. So I'll bet you can do 4 minutes too. Yeah, you can do it. Okay. So just keep thinking, keep concentrating. Yep, you got to concentrate, because you've got to be aware of what's making you cough. Because it's kind of automatic, but it's kind of like breathing. Yeah, you don't have to think about breathing, but you can control your breathing if you want. You can hold your breath, you can breathe more. Right? Remember what I said, you start feeling that, take a slow, deep breath, because it helps a little bit too. And in addition to sipping a little bit of water. Great. Great. Have you ever had a mosquito bite? No? You never had a bug bite? Never had anything on your skin that itches? You ever noticed that the more you scratch it, the more it itches, and you have to stop scratching it? This is kind of the same thing. The more you cough, the more it causes that feeling back there that you have to cough again. And just like you have to stop scratching something in order to heal up and stop bothering you, you've got to control the cough, which is harder than not scratching. I'm not saying this is an easy thing to do. If it was an easy thing, we wouldn't be here. It's hard because it goes on and on and on. But what you're doing is learning to hold it back, even for a little bit. And the longer you can hold it back, the easier it's going to get. You've got almost 3 minutes now. Almost. And you get 1 more minute. Okay? The longer you can hold it back, the easier it's going to get. But it's hard to do. It takes a lot of concentration. Don't let your mind wander. Your mind wanders, and this automatic cough's going to come again. So you got to keep thinking about it. Kind of boring, but it's important. Hang on there. Keep thinking. Yeah. Slow, deep breath too. Slow breath. Good girl. You're doing great. Another 20 seconds, you'll have gone 4 minutes. Okay. Slow, deep breath. Make that, control that annoying feeling. And that feeling has occurred because of this very long period of you been coughing. I'll look back. Okay, you've gone 4 minutes. You're doing well. Hang in. Keep concentrating. Keep concentrating. As we're going to go 5 minutes next. 5 minutes. Slow breath. Relax, but keep focused on me and think of nothing else. But be aware of it before it coughs. Be aware of what you're feeling before. And when you feel it, take a slow, deep breath. Take a sip of water, but keep controlling it. Good girl. Good girl. Okay. Deep, slow, deep breaths. Relax. And just keep listening to me and stay focused. Think of nothing else. Okay? You're going to do 5 minutes, and I'm sure you can, right? Because you did 4 minutes. If you can do 4 minutes, you can do 5 minutes, can't you?
right? You can. But it takes a lot of brain power to do that, doesn't it? Yeah, I know. It's hard. Okay? So you keep thinking, keep concentrating, take some slow, deep breaths. Real slow, real slow, real slow, very slow. Relax, stay relaxed. You're doing great. You're doing great. Stay focused. Keep your eyes on me. Don't look anywhere else. Don't think of anything else. You gotta keep your mind working on one thing. On one thing. And that's not responding to that feeling there. I'm not gonna do that. You're doing, hang on. Good girl. Good girl. That's right. It was hard. You're feeling it there, right? Take slow, deep breaths. Slow, 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 slow. Great. Okay. Concentrate. Keep your mind focused on that one thing. Don't think of anything else. You're getting all your brain power on one thing, because you've got a lot of brain power, but usually it thinks of a lot of things. So right now you're not letting it go anywhere else except concentrating on when you feel that. Hold it back. Take a deep breath. Sip a little water. Yeah, that'll help. But the main thing is using your brain to hold it back, to control. You're going to take control. You're not going to let the cough take control. Because you're smarter than the cough, aren't you? Yeah. You're doing great. Hang on. It's hard. It takes a lot. Hold it back. Good girl. Good girl. Hard thing to do. So, you really have to concentrate. Okay, you're doing well. You're doing well. Okay. But the longer you go, the easier it's going to get. The longer you can go, the easier it's going to get. Okay? It's still going to be there. It's not going to go away completely. Not for a day or so, because you've coughed for months. So you've irritated it back there. You've bothered it. And that's what's causing the cough. But if you can stop it from happening, it's gradually going to heal up. And you won't have to cough like you have been. 20 seconds, it'll be 5 minutes. Hey, you can go that much longer, can't you? Yeah. Okay. Yeah. Hey, feeling it now, but take slow, deep breath. Slow, deep breath. Good, you're good at this. I can tell you're good at this. Hey, you've gone 5 minutes. You've gone 5 minutes. We're going for 6 minutes now. Okay? You've gone for 5 minutes. Still there, right? Okay? Slow, deep breaths. Slow, deep breaths. Okay? Keep concentrating, because the longer you go, the easier it's going to get. It's getting a little bit easier now, isn't it, to hold back? I saw it was starting to come out there, and you did a good job of holding it back. And that's what you got to do. Your brain has to be the boss here. You have to be the boss, not the cough. Cough is kind of automatic. It just happens without you thinking about it. But if you think about it, you can hold it back. Not easy, but you've been doing it. You've done it for 5 minutes, and we're going into 6 minutes now. Okay. Keep concentrating. Think of nothing else but holding back. Think of nothing else, and take slow, deep breaths when you start feeling anything. Good girl. Hey. Hey. You're going to send that cough packing, aren't you? I'm sure you will. Okay. Now that feeling isn't going to go away completely, but not for a day. What you're doing is learning how to take control and not have it keep going. Because the more it coughs, the more it's going to cough. The cough causes the cough. So if you hold back the cough, if you get your brain to do that, it's going to gradually get better. You're doing great. Nice slow breaths. Relax, but stay focused on me. Keep thinking of nothing but the cough, not the feeling that you're holding it back. The feeling that you're holding it back. And you keep holding it back. Okay, keep doing that. Getting the feeling, take a slow, deep breath. Relax. Slow, deep breath. Keep looking at me. Slow, deep breath. Great. Okay. Keep focused. Remember, it's the cough that's been causing the cough. The cough causes more irritation there, and it's irritation that makes someone cough. And so you have to break the cycle. You have to break the cycle. You're doing great. Keep holding it back. Keep holding it back. Slow, deep breaths. Keep concentrating. Yeah. You're doing great. You're very good at this. You're very good at this. But it's working, isn't it? You're able to hold it back longer. Each time, you're able to hold it back a little bit longer. Okay? And we're going for 7 minutes this time. 7 minutes, and you're doing it. In 7 minutes. Great. Keep concentrating. Very boring, I know. Just have your mind on one thing. But it's important, because that's the way you get control of something that your body wants to do. And that's what you're doing. You're taking control. You're going to say, yes, I've got that feeling that I have to cough, but I'm not going to let it happen, because I'm the boss. Okay? Slow, deep breaths. Slow, deep breaths. Right. Keep concentrating. Great, you're doing it. It's fantastic. Fantastic. You're really good at this. You're getting there. You're getting there. Yeah, because the longer you go, gradually it's going to get easier. And it's getting a little easier, isn't it? It's not gone yet, but it's getting a little easier to hold it back. And that means your brain is controlling it instead of just letting it happen. Okay? Good girl. Good girl. Okay? Yeah. This is not a real common problem that you have, but you're not the only one in the world that's at it. Mm-hmm. I've seen a lot of other kids with this. Used to be about 7 a year in our clinic, so that's not common, but it happens. Okay. And this is what you have to do to get it under control, to get your brain to take control of what your body is trying to do when you're not thinking about it. And slow, deep breaths and concentrating. You've gone 7 minutes. We're going for 8 minutes now. Okay. You're getting there, aren't you? Yeah. Feeling you've got a little more control over it now, huh? Yeah. Okay. So we're going for 8 minutes. Right. Just hang in. Keep concentrating. Keep saying, I can control that. I can control it. I can feel it, but I'm going to not let the cough happen. I'm just not going to let it happen. I'm not going to let it happen. Take a slow, deep breath when you need to if you feel anything. Good. Yeah. You're doing great. You're on your way to, in addition to the 7 minutes, and you did 7 minutes in addition to 6 minutes, so you've done 13 minutes already that you've held it back. Yeah. And you're going to keep doing it, because the longer you do it, the easier it's going to gradually get. The longer you do it, it's gradually going to get. It's not going to make it feel it go away right away. It's like a bite that you've been scratching. It takes a while to heal up. But until you stop scratching, it doesn't heal. It's the same thing until your brain learns to control that cough and not respond to that feeling. It's going to keep happening. Good girl. You're feeling it now, huh? I can tell. I can tell when you're feeling it. And that's when you've got to really concentrate. That's when you've got to really concentrate. Yeah. Slow, deep breaths. Slow, deep breaths. Slow, deep breaths. You know, when you add up the different times, it's getting to be over 20 minutes since you coughed. And that shows you can do it, right? Not easy. We're going to go longer, because the longer you go, the easier it's going to get. The longer you go, the easier it's going to get. That's what you have to be thinking about, because you're controlling it. It's not controlling you. You're the boss. Your brain can control it, not just respond to that feeling. Okay, good girl. Okay. You're doing fantastic. You're really doing well. Feeling is still there, but you've gone more than 20 minutes controlling it. Okay, we'll keep going a few more minutes, because I want you to keep controlling it. Because keep in mind, you're the one that's controlling it. I'm not doing anything except teaching you what to do. You're the one doing it, which means you can keep doing it even if I'm not there, right? I think you can. Because what we're doing here, you can do on your own later if the feeling is still there and starts bothering you. And if you do this, if you keep thinking about it, again, the longer you go without coughing, the easier it's going to get. And after a day or so, that feeling's going to go away as it heals. Like a bite that's itchy, you just got to heal up. It takes a little while. So keep some water around. Keep some water by your bedside. And remember the slow, deep breaths. When you're feeling something, you do something else other than coughing. You say, I'm not going to cough. I'm going to take a deep breath. I'm going to sip a little water. I'm just not going to cough. Okay? Because you can control it, right? You've been doing it. So you know it can be done. You know it can be done. And that means anytime it starts happening, you think about it. You can control it. It's when you're not thinking about it that it happens by itself. You're still feeling it, but you're controlling it. Remember the slow breaths too. So, again, that nasty feeling is there, huh? But you're controlling it now. It's not controlling you. Okay. You've gone almost half an hour now. I think you can keep doing it on your own now, can't you? I think you can. Yeah. So what I'm going to do now is I want you to just keep thinking of your own. Okay? Keep thinking on your own. Okay? Slow breaths. Okay. Don't let that feeling make you cough. Because you know you can hold it back. You've done it. You've done it for half an hour. So you can do it. Not easy. But you're showing you can control it. Okay. 6 slow breaths. Slow, deep breaths. It's bothering you, isn't it? Yeah. But you're controlling it, even though it bothers you, because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Keep thinking about it. Hold it back. Good girl. Keep looking at Mel when you and take a slow deep breath. Slow deep breath. That helps a little, huh? Taking the slow deep breath. Okay. Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad, but you keep thinking by yourself. You keep control.
My full session with Dr. Weinberger is on our website at habitcough.com.
Please be advised, this was our experience with Dr. Weinberger. Yours might certainly differ, but talk to your pediatrician, talk to your pulmonologist, talk to your child's doctor, and let them know about habitcough.com.